Well, SPIRE is a tool to provide details for GPs of their own patient information in ways that they can easily understand, both the information in their own practice, but also when we join together in our new GP clusters, it's an opportunity for the clusters to decide what information they need and it to be presented back to them in a way that's useful. Well, they can, for example, analyse how many of their diabetic patients have got eye problems, that they maybe need to do some more screening for eye problems or more interventions to reduce eye problems. That's the kind of thing. Or, for example, look at how many patients with stroke have a disability and perhaps get them linked into an exercise programme. So there are many different examples of how, with the right information, you can target the right kind of things to help people with their everyday lives. I suspect patients won't see very much difference in everyday life. What they will see in the long term is a sustainable and more effective NHS, and that's something that we all have to be interested in, both in terms of spending the country's money well and living healthier lives. I think there are some things in life you absolutely need, and understanding the problem is the first one. Once we understand the problem of Scotland's health, we're much more likely to be able to deal with it. And SPIRE's all about understanding the problem, and I think it's well worth the money, and we've done it the best way we can think of to do it. So I would commend it to patients and say, this is what we need for Scotland. I've spent many years looking at the problems of public databases, and I have a lot of experience in that, and I insisted on a whole range of security measures as part of the profession, the medical profession in Scotland, and this has been built into SPIRE. So in that sense, it's as good as we can make it, and I would say it's as secure as the patient information I hold in my own practice.